This past June, the American Heart Association added sleep to its checklist of essential things, including and being added to nicotine exposure, physical activity, diet, weight, blood glucose, cholesterol, and blood pressure. Why has this been added? Well, there's a growing amount of research that's showing the connection between sleep and heart health. So given that February is Heart Month, I wanted to focus this week's Wellbeing Wednesday on the relationship between sleep and heart health. What we do know from our research is that people with common sleeping problems, such as obstructive sleep apnea or insomnia, are actually at higher risk of having many different cardiovascular difficulties, such as arrhythmias, coronary artery disease, heart failure, or even just seeing plaque build up faster in their arteries. We see individuals with common sleep disorders such as restless leg syndrome, which can affect about 7 to 10% of the general population, can also have an increased risk for heart disease. So if you're having these sleep concerns, you want to be checking in with your doctors for your heart health as well. We also know that poor sleep can have an impact on our diet, on weight gain, which we know has an impact on our heart health, making the heart having to pump more or to be able to have impacts on our heart health in many different ways. Additionally, looking at past research, we found that individuals that are not getting enough sleep are going to have an increased risk for diabetes type 2, which we know for individuals with diabetes type 2, they're twice as likely to experience heart attacks or stroke. Plus, we find that for individuals that aren't getting enough sleep, this can increase inflammation in the body, which again is going to have the impact on heart health. So as we're thinking through this, we also want to be thinking about not just those that are becoming more and more mature, but even for our teens. Research has shown that irregular sleep schedules, individuals are twice as likely to develop heart problems and heart disease. And in the teen years is actually when our arteries will start to be able to build up plaque, which later on has issues for heart health. And so we can see that poor sleep for teens can potentially contribute to that process happening even faster. So we want to be doing all of our tips and strategies to be getting better quality sleep. Make sure we're having that consistent sleep schedule, that cold, dark, quiet, comfortable place to be sleeping in, having that consistent schedule 7 days a week of bedtime and wake time, and avoiding light in the evenings, especially when we wake up in the middle of the night, and trying to avoid our technology too close before bed. Be well.